Hi, everybody. It is Mary Gardner, and I am here to answer some questions live. Well, not maybe totally live, but we put out a question last week to see if you guys had any questions that you wanted me to answer on this Facebook Live. And so I'm here to answer those that came in. So if you are watching, please let me know where you're coming from and what kind of pooch or kitty that you have and how old they are. So I'm just going to go straight down my list and go over some of these questions that were already submitted. And if you have any more, you can certainly do that. If I have enough time, I will absolutely answer them. So without further ado, let me get started. Okay, so first up question is one of my favorites, and that is, at what age is my pet considered a senior? And when I lecture at veterinary conferences, I usually say, well, how old are we when we're considered a senior? And there is a big debate. So some people will say 65, some will say 55, some say 50, and then some say whenever the AARP sends us a card, if you will. So senior, even in the human sense, is really just a number. And it's not necessarily reflective of your biological concerns that you may have. However, I'll get off my soapbox on that because that is one I love to sit on. And what we say in humans is that typically when you're 55, you're considered a senior. And then for pets, it depends on what species you are, right? So a hamster is not going to be senior at 7. Yet a dog, we consider a dog to be senior at 7. And then also a cat is usually 7 or 8 as well. Now you might say, but what about those different sizes of dogs? And does that dictate if they're senior later or earlier? So if we think about a large breed dog, like a Great Dane, we know that sadly they do not live as long as a smaller dog. However, we usually still say that all pets are senior at about 7. But we know that the lifespan of a bigger dog is not as long as a smaller dog. And there's a lot of reasons why, sadly. So when your pet turns about 7, and for a cat too, 7 or 8, we should start considering them as a senior, just like us when we turn 55, and making sure that we see your veterinarian more often. And get blood work done, get a full exam done, look at those teeth, especially the smaller dogs. Those teeth are like hot garbage. And we got to make sure that we keep them clean and so many other things. So that's why it's really important to start seeing your vet as a senior. Now, everybody who knows me well, I love a geriatric dog. And what is that? Well, a geriatric pet is like a geriatric human, where they're fragile and they have a fragility syndrome, where they also may have some ravages of old age, like incontinence, mobility issues, decreased vision, decreased hearing, maybe a little cognitive dysfunction and things like that. So senior doesn't necessarily mean they're bad or fragile, but it is certainly a time, just like us, where we should start taking care of ourselves a little more. I mean, to be honest, we should take care of ourselves the whole time, but definitely see your veterinarian a little bit more when your pet starts to turn 7. Okay, that's first question. Next one, this is a good one. How can you tell if your pet is in pain or suffering? So I want to break this up in a few ways. First off, what is pain and what is suffering? And those are two different things. And we can get, guys, I could talk about this for an hour. So let's talk with pain. Pain is not only physical pain like arthritis, but there is also social and environmental components to pain. So for instance, if you suffer from anxiety, are you in pain? Well, it's different than arthritis, right? That kind of pain, or if you broke a finger. However, you're still in pain. So it's not just the physical pain, it's also an emotional and social component to pain itself. So please know that if your pet has anxiety, or your pet is, anxiety is such a big one, right? That still means they're in pain. If they're in respiratory distress is painful, but it may not be the same thing as nerve fibers with arthritis and bad hips and stuff like that. However, they are just as important to recognize. So if there is an outward sign of pain, you will usually notice it in limping, in, even if they make a noise, constant licking on a wrist or another part of their body is very typical of showing that they're in pain. So a lot will lick their wrist if there's arthritis there. They may wince. As far as anxiety goes, they may have their ears pulled back. Their face just doesn't look calm. I think you kind of know your pet's facial expressions really well. Some other little things to recognize is that sometimes cats won't be able to scoop their litter when they're trying to cover after they've gone to the bathroom. So your cat you may think they're getting sassy because they're not covering what they've just done, but maybe they're actually in pain and they can't do it. It could be also as simple as having a harder time getting down when they want to lay down or they can't jump up anymore. But when a dog or a cat is dealing with chronic issues, it's very difficult sometimes for you guys to even recognize. Acute pain, as in they've broken their leg or something hurts, they're very vocal about it. But when you've got a dog or a cat that's dealing with chronic pain, it's not always easy. So you really should have your veterinarian assess it, because we will feel for edema or fluid buildup in certain joints. We're going to feel for creaks in their joints as well. A kitty cat may not groom themselves because they can't get back there because it's painful. So there's so many things that you may not recognize, but we can. And now the second half of this question is, what is suffering? And that's tough, because do we all have a good definition of what suffering is? And there's not a good definition. Well, there are, but it's a little bit more etherical, if you will. So what is suffering? To me, I can be in pain, but I'm not suffering. Right now, I've got something going on. It hurts. You guys wouldn't know that. Do I appear to be suffering? No. But in my definition of suffering is that when I can't think or do anything but concentrate on the pain that I am in, I am suffering. So if your pet can't do anything but think about the breathing difficulties that they're having, or they have anxiety because now they've got cognitive dysfunction and they're worked up because they're scared of things, that is suffering. And we never want our pets to be suffering. So we absolutely should address their pain as well as their anxiety and some other things. So I know that was long-winded, but hopefully that was helpful about how can you tell if your pet is in pain or suffering. Okay, next up question. Any tips for a gray muzzle who keeps slipping on the tile and wood floors? Oh my gosh, I talk about this all the time. Number one thing is they need traction. So if they're slipping, then you absolutely need to provide either carpets, yoga mats, bath mats, things that have the sticky bottom. And then there's also booties and some other things that I always recommend. There's something called toe grips that was invented by a veterinarian. And so anything that provides traction, because if they slip, they're not going to use their muscles well. They're going to get atrophy, and they're not going to be wanting to go where they should go. And then they're going to get even worse. So imagine wearing high heels on an ice rink. That's what some of our floors are like. And did you know that if you're in pain, distance seems longer? So if you have a dog with arthritis, the distance, let's say, to the kitchen actually appears longer to them. So we want to make sure that they don't have troubles getting there. So we got to make sure our floors are more grippy, and also be careful about stairs. Oh my gosh, I go to homes and I'm always so nervous about seeing these stairs, particularly on the landing. So they'll come down, boom, 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 and then they hit the landing and they've gotten into trouble. Okay, next question. My cat is 15 and not very playful anymore. How can I make sure she's having a good life? Fantastic question. So I would say cats, it's interesting. There was a study done, and I forget the statistics, so I'll just be very vague, that they were looking at what dog owners considered to be a good life for a dog and what cat owners consider to be a good life. And going for walks was a big deal for dogs, but for cats, it wasn't so much, for obvious reasons. And it was like laying in a sunbeam kind of a thing. However, I love making a joys of living list. So every pet, dog or cat or ferret or whatever, you should have what makes them happy. And also what makes them really upset, because sometimes they find joy in getting a little upset over some things, and making sure that they're still doing a lot of these things. A really big problem in cats, though, is that we don't recognize that they are in pain, and they are. If I'm not mistaken, there was a study done where cats over 10 years old were being X-rayed, and 100% of the cats were shown to have arthritis. But they're not very vocal about their pain. They're vocal about when they get food, right? And they may wake you up, but they don't really tell us about their pain so much. So for cats, and did you know, here I go with more stats, I'm sorry, that 56% of cats do not see their veterinarian in their last year of life. And I can't tell you how important it is to make sure that they don't have anything going on and that we address any pain that they may have. And then they will have a better life. So make sure you do a joys of living list. Make sure that they are going to still be doing some of those fun things. And listen, remember, when I was 18, I was climbing up a tree. I'm not doing that anymore, right? But so we may not see our cats climbing up that cat tree, but it may also be because they hurt and we have to fix that pain. So definitely make sure that they go see their veterinarian to make sure they're in tip-top shape. Okay, I've got another one. My dog is having difficulty getting up. Do you have any tips to help? Oh gosh, so this goes right along with my flooring. They need traction. Next time you guys are on an ice rink, try to get up. And that's what some of these dogs are like. I always recommend keeping their good pedicure. So keeping their toenails short. And I know some of you do not like to clip your dog's toenails, so bring them to the veterinarian. They may charge, which is okay because you guys don't like to do it either. But we could do it really well. And then also trim the fur in between their little tootsies, because sometimes they'll get the Grinch feet and they'll have all this fur, and that's like socks basically, and they're slipping on the floor. So make sure they have traction so they get up. And if I may recommend, the best harness I believe in the universe is the Help 'em Up harness. Help 'em Up. So EM harness. Help 'em Up harness. I do not get paid a dime from them, and I love this harness. It's anywhere between $100 to $120 maybe for the harness, and then there's other accessories. This harness is amazing. You keep it on the pet the whole time. I always recommend taking them off once a day, making sure that they don't have any, rub marks or anything like that. And you can just easily pick them up. Oh, Patricia says she agrees. I bet you're agreeing with my harness, I think. But it's so easy to help them up. That's the name of the harness. And I like to keep it on because when they need help, you don't always have the towel around or the other harnesses that you got to just put on when you're ready. So that is my biggest tip. Okay, next question. How does veterinary hospice differ from care my pet gets from their primary veterinarian? Okay, this is, every question is really good. I keep saying this. So hospice, you can get hospice from your veterinarian. It is a different type of treatment plan. So with hospice, just like in humans, we are no longer curing. We're not looking for curative options. We are absolutely focused on making sure they live well until we have to say goodbye. That is the focus of hospice. We are not, as hospice veterinarians, we're not going in to diagnose. We are not going to be chasing numbers. So if you want to know what BUN creatinine is of your pet that's got kidney failure, that should be done at your general physician. We're not going to redo x-rays or ultrasounds. We're going to maybe have a diagnosis. 50% of pets have not been to their doctor in years, so sometimes we don't have an actual diagnosis. We know we're just dealing with incontinence. And there's a long list of reasons why pets can be incontinent. But we're going to deal with those with the incontinence and how to make sure that they're comfortable and safe and clean and things like that. So with hospice, we are focused on making sure they live as best as they can, as pain-free as they can, and as anxiety-free as they can until the very end. So hopefully that answers that. Okay. And Nikki says the difference also, good point, Nikki, is that we don't have to drag them to the veterinarian. You're right. A lot of dogs and cats do not like to go they don't like to go see us. It's like us. Do we always love to go to the dentist? Although I do like a good cleaning. But it is very difficult, particularly with these bigger dogs that have arthritis, to get them into a car. and bring them to a veterinarian. So we are in the comfort of the home of the pet, but it is really important to know that our focus is not curative. So if you want to explore chemo and radiation or some other stuff, which is totally fine, that you need to have through your veterinarian, your general veterinarian, or your specialist. Okay, next question. Oh, just what I was talking about. So how can I help my 11-year-old dog who's struggling with incontinence? First, really important is to rule out something that we can fix. So urinary tract infections can be a cause of incontinence. And if any of you ever had a UTI, then you know we really need to work on that and fix it, because it can burn and hurt. So first is to make sure that there isn't an underlying medical reason. Other medical reasons: diabetes, kidney failure, medications that they could be on. So if you've got a dog in heart failure like I had, the medications made them pee a lot more. Cushing's, I'm missing a few, I'm sure. So we want to make sure we rule that out, because we need to address the disease first. Then there is old age incontinence. And one day we may have this as well. And there are some medications that can help. There's a lot of drugs that we would try to help with that sphincter. It's just a muscle. So that sphincter, also acupuncture could help. That you would want to get through your general veterinarian or acupuncturist. The medications through your general veterinarian. And then also, there's wee pads that you can put on the ground. But if you've got a big dog, they're not going on the wee pad. So let's just talk about diapers real fast. And I've done another video before about diapers. I have used diapers on my own pet, particularly with urine incontinence. And that's what we're talking about. I'm talking about urine incontinence, because then that's a whole other topic, is fecal incontinence. Maybe I'll do a video just on that. The big important thing to remember with diapers is that they need to be kept clean, and it can predispose them to UTIs. So having that urine or feces around that area, just sitting there, it can preclude UTIs. Okay, hopefully that answered that. I got some more questions coming in too. What can I do to make sure my pet enjoys the remaining time they have left? So I kind of went over this with the kitty cat one. Do the bucket lists. Oh my gosh, I love bucket lists. So making sure you're right. And they don't have to be grand, right? We don't have to jump into our Subaru and go to the Grand Canyon. My bucket list for my boy was peeing on the neighbor's plants, because he loved to do it, and meeting new girlfriends and things like that. So, so just love bucket lists to try. Now, I'm going to answer some of the questions that are coming through, but a lot of what I've talked about is actually in my book that was published in January. I don't know if you guys can see this the right way or it's backwards when I show it to you, but the title is It's Never Long Enough, because no matter how old our pets are, it is never long enough, right? So this is focused on dogs, and I'm working on the cat book, which will come out this summer. But I talk about all the products that I recommend. It's big. It is like War and Peace. But I go over everything about aging, how we can slow the aging process down, caring for them. Look at, I'm going to put it like that, little cell there. And then also end-of-life decisions, caregiver goals, euthanasia options. It goes over everything. So don't forget, the cat book will come out this summer. Okay, so I'm going to hit some of these questions I see over here, if that's okay. So Tammy says her dog is in renal failure and it's so hard to let them go. How do you deal with the guilt of euthanizing your dog? Oh, Tammy, this is a question that I do get often. And it's hard. I have it myself when I'm saying goodbye. And, you know, I'll tell you two things. I like to think that I never want my pet to die because of the pain or the symptoms of their disease. I want them to go on a good day, which is hard because we want every good day. We don't want to give them up. But I want to make sure that they are pain-free as possible. And with renal failure, that's tough for you to assess that. Nausea, they'll get nauseous. They'll feel dehydrated. They'll just feel crappy. And if you ever have had the flu, that is kind of what I liken it to, is that feeling of, ugh. Disease is dis-ease. They just don't feel good. And especially if a pet has got nausea, I really want to make sure that we try to put them on anti-nausea medication, because I hate nausea. That's the worst. But please do not feel guilty, because we are not ending their life. We are ending the dying process. When you are in end stage organ failure, they are already starting the dying process. When that is going to happen, and we are making sure that they die with you by their side, with you holding their paw, with you saying, thank you for protecting me from the mailman and everything else. And that is what we need to focus on. We have to focus on making sure that they get the best goodbye that we can provide. And I know it's so hard, but Tammy, please do a bucket list. It will help you feel like you've done everything that you can, and you have done everything that you can. And this is sometimes the hard thing to do, is to let them go, right? I always say we have to suffer so they don't. And the last thing I'll say is I once went to a pet loss group. And by the way, we have wonderful pet loss group that does talks on anticipatory grief as well, because you're probably dealing with that. But when I lost my Samoyed, who's right there, I went to a group. It was locally here in South Florida. And it was the first time I ever went to a pet loss group. And to be honest, I wanted to go to see what it was like. And so they asked me to tell my story, and she had Cushing's and diabetes. And so I said I had to let her go. Very similar, Tammy, that when you would have to let yours go. And so this woman who has been going for a year says, I said, I let her go. It's better a week too soon than a day too late. And, she was still having some good days. And this woman said, how dare you take away those good days from her? That's the guilt trip I got from this woman. So I just looked across the table and I said, I took some good days, but I stole a lot more bad days. I never let her experience those bad days. That is what I focused on. I wished I could have had every single last minute, but that would have been for me. So sometimes we have to let them go when we don't want to. Okay. So I hope that was helpful, Tammy. Next up, let's see. Oh, Nikki, go to Dr. Mary's Amazon page. Yes. So I have an Amazon page. I'm going to edit this thing that's on your screen. Let's see if I do this right. Dr. Mary Gardner. There we go. And anytime there is something, let's see if that works. Anytime there is something that is sold on Amazon, I will put it in my page, and I categorize it for incontinent products, mobility products, things like that. The Help Them Up harness is not sold on Amazon, so that is something you have to get from their webpage. Okay, so toe grips, that's a good one too. So I guess you have to think you are releasing them. Oh, sorry. So Keely says, I guess you have to think you're releasing them from pain and setting them free. 100%. It's tough. So Ben said that we helped them. You're still in shock because your liver failure happened so quickly. I agree. So he says, my family's ready for a new dog, but I find myself wanting another just like our old girl, having to clear your mind and welcome a new best friend without comparison. Huh? I hear you. So I lost my Doberman when he was 9, and I went on a Doberman rescue, and I adopted a 6-year-old Doberman. And I think it was very helpful for me because I was not ready to lose that big dog in my house. I didn't want a puppy. And so I got another one, but instantly I knew Duncan was so different than Neo. There is no replacement of the oldie, our old little crusties, and they may still be with us before you get a new pet. There's no replacement. It's just a different love. And I understand you'll never clear your mind, Ben, and you shouldn't. Your first one or second or third left a beautiful mark on your heart. Okay, so the Help Them Up harness for your lab math. Yes, Teresa. Okay, good. Game change. Everybody loves the Help Them Up harness. Let's see. Keely was responding to Ben. Oh, you guys are so great for each other. How do you get a dog with Addison's disease to lose weight instead of gaining it? Ooh, so that's tough. Addison's is a tough one, and it is the opposite, being very vague here, of Cushing's. And it's very important to make sure that they are on their good medicine. This is a tough disease. And also, I would definitely recommend getting a nutrition consult. And Hills does nutrition consults for veterinarians, and so do some of the other food companies, just to help maintain that they've got the right the caloric intake. Because you know what happens, Michelle, too, is that we like to give our guys a little extra treats towards, as they're getting older. Oh, he's getting old. Let's just give him a little something, comfort food. We've got to make sure that we don't give them extra treats. I love carrots, green beans, and things like that to keep them occupied. Also, make it hard for them to eat. So I love putting a bowl of some of their wet food and freeze it, and they'll just lick it. And especially in the summertime, that could just slow them down. There's a lot of food bowls that slow them down too, and they then feel like they've gotten enough food. Because I forget what it is. It's like 15 minutes that it takes the message from your belly to get to your brain that you're full. So remember this. I think it's Haru Hachibu or something like that, the Japanese saying that says, stop when you're not full. Because in 15 minutes, you're going to feel full. So if we slow their eating down, that's also helpful. Okay. Ben, how do you make the decision to continue aggressive care versus saving the trauma? And let's face it, the cost. Right, Ben, for a situation that may end up with the same result. This is a very good question. I think you have to think about what the result is, and will your aggressive treatment change what that is? And if it isn't going to change it or make it better, then I wouldn't necessarily move on with it. So for instance, I'll throw myself under this bus. My girl Sam, she had spinal lymphoma. I did radiation and chemo because I knew that would give me more time, but I wanted to make sure she had good time. And I stopped when I knew it wasn't the treatment that was killing her, it was her cancer. And so I made sure, though, that I stopped that. I knew I was going to get as much time as I could, and then I'm going to focus on just caring for her. She still went to rehab, and she did her water treadmill and all this stuff that she was doing, which she actually liked. But it's hard, and there is a cost to this too. And I'm glad you brought this up because there are some budgets, but don't forget, it's not just the cost. It's the time budget to care for them, the physical budget, and the emotional budget. And sometimes we're done. We're done. And please, no one judge anyone else when they are done, because it is hard to care for these guys. So that's where I love hospice, because then we can just focus on making sure they're comfortable, they're safe, that you guys have your support system that you need until the time comes. But there's a lot of aggressive treatment options that we can do, but just because we can doesn't mean we should. And every situation is different. No judgment from any of us veterinarians at Lap of Love, whichever way you decide. George helped you, Lori. She's wonderful. So a lot of good messages coming through. I'm looking for a question here. So we are guessing your pup, Patricia. She's about a 12-year-old black lab, 136 pounds. That's big, Patricia. Has DM. Any suggestions dealing with this? Okay, so DM is degenerative myelopathy. I don't know if I've done a video on that before, but it is a really nasty neurological disease that you'll start with like toe flipping and dragging. All those products I recommended with the Help 'em Up harness, that's huge. You gotta move them. So we've got to get them active. Physical therapy is great. Acupuncture is great. Walking them on grass, on different textures, massaging their little tootsies. Everything is so important with DM. You got to keep those neurons firing. So don't just let them sit around. I'm not saying that you are, but that's for anybody. Also, I don't know if 136 is okay, or if we're a little bit on the round side. Keep them skinny. All guys with arthritis, you got to keep them skinny, but that will help them get around. Also, if they're toe dragging, you can put those toe grips on, like we mentioned, or also just get toe caps, which is different than the toe grips, because if they're dragging on the cement or the concrete or the asphalt, they may get their nails start to get worn down and bloody and gross. That's happened to my girl. So I put the toe caps on to help. All this, again, is in the book, too. So bucket list. Yes, I want to make sure Joy, how do you train an older dog to use a wee-wee pad? This is why I say it's not easy. I'm not the best trainer, not going to lie. So it is a lot. It's really, really hard. There's a lot of Facebook groups out there for most of these diseases and also incontinence. And they have tons of ideas that could probably help you out a little bit better than I can. It's tough. That's why I went straight to the diaper. Where is a close hospice vet for me in the Jasper, Georgia area? So Karen, if you go to our website and put in your zip code, if we service that area, we will certainly come up there. We are working on a directory that will direct you, as the directory is, to other veterinarians that provide hospice care that may not be lap of love, because we're not everywhere yet. But also speak to your veterinarian. They may know of somebody as well. Let's see. Maria, she's reading my book now. Awesome. I hope you like it. Christy, my dog has incontinence due to UTI and prostate issue already. So I'm using the disposable diapers, and they pull all the urine away from the body and are dry to touch. I love it. Make sure he's got a clean one on hand. Yeah, you got to keep them clean. So good job. Crystal. I think I said Crystal. Okay, so also Crystal is dealing with maybe prostate cancer. I'm not certain I will treat if he has it or not. He's young. It's heartbreaking. I don't want to put him through something that makes him feel horrible, not long enough for a final period. Okay, so Crystal, I would definitely recommend speaking to an oncologist unless your veterinarian is very well versed on prostate cancer and all the different options. Just understand the options. My girl went through radiation and she did really well. I have family members that go through radiation. Chemo, 80% of dogs do not have any symptoms from chemotherapy. So we can manage nausea or inappetence or pain really well, but 80% don't even feel anything. So just talk first to a specialist. And if you still decide not to, that's okay as well. All right, let me just see. I just used a service in Orange County, New York, Pat. So Pat, shout out to my hometown. I am from Orange County, New York. I was born and raised in Middletown. So go Middies. And I'm glad that Dr. I think it's Marcy up there was able to help you. So let's see, Amy, we assisted. You were a little angel. Pity. Oh, pitties have smiles for days, don't they? Okay, let me see. I'm just looking for new questions. My goodness, you guys are on a roll here. Tammy's got a dog named Chubby Checkers. Almost 16-year-old Aussie, and he's starting with nausea again. And we have to help him up and down all the time. So perfect. Chubby Checker. I hope he's not chubby. So Sheila had to put down their 10-year-old Millie, but the other dog is 13 to have a separation anxiety and sad. She keeps, yes. So in my book, I talk about other dogs and cats that do get separation anxiety or depression, if you will. We also have some content on our website about that. And there is a big percentage of dogs that will. So that's why I say don't wash all the blankets and the collars and things like that, because even that smell will be helpful. All right, let's see. I just want to make sure, oh my goodness, if there's any other good ones out here. I mean, they're all good. Don't know if you answered it, but my 2-year-old has been diagnosed with one vet with wobblers without a scan, took him to a regular vet and diagnosed him with arthritis. Wobblers, I would 100%, I don't know if you can fully diagnose it with an x-ray. I can't recall because this is a younger disease. I like the old guys, so I'm not as up to date on my younger diseases, but I believe you need to have at least an x-ray and possibly and I wonder if you have a Doberman or a Weimaraner or Grace, an MRI. I think you may need an MRI, but I could be wrong. So I'm sorry. This is a younger one. So I know it said ask me anything, and I'm not doing so good. Shih Tzu. Let's see. Okay, Faith. I wish we had you around years ago. I had a cat that was 17. I'm sorry that you had a bad experience, Faith, with your saying goodbye. Okay, I think I have hit almost all these questions. Whew. Grace is a dachshund. That's a little small for wobblers. Not saying that they don't read the book or can't go outside of the book. So, like I said, I can't recall. I'm sorry, Grace, if we need an MRI or not to fully diagnose the wobblers. So definitely check it out. I mean, if your dog is only 2, I mean, it's a dachshund though. So those guys, I hate to say, have a lot of back issues. But it's currently having problems, then I would think about wobblers because it is a younger disease. Okay, so, okay, Gina. I have a very overweight Gina, thank you for admitting this. I have a very overweight 11-year-old Beagle mix scheduled for a TPLO surgery, has arthritis all over. The appointment was 3 months ago with the surgeon. All I could get, was made 3 months ago, 3 months out. Yes. We are thinking of putting him down instead. So, Gina, if you don't put him down, it's a 11-year-old Beagle mix. So yes, older. TPLO is a big surgery, but I've had a version of TPLO on my own body. And it is really important to try to get the weight down. So a good thing is you do have time. You have 3 months, and let's try to get like 10% down. That is going to help with recovery and rehab. And there's some great drugs, Gina. Everybody sometimes is scared to just try some good drugs. And when we're painful, we take them. And it's not bad to have our dogs and cats on some as well. Okay, so Michelle, another question's on prednisone every other day. He drinks a lot of water and acts like he's hungry all the time. That's him on 70 pounds. So I don't want to mess too much. Like there's a lot more to this with Cushing's and Addison's that you have to look at. Michelle, there's nothing wrong with scheduling an appointment with the specialist. An internal medicine doctor may be something that you're at. Addison's and Cushing's are not easy diseases, and it might be something just to look at. But look he's gained 14 pounds. So he wants him skinnier. Also, what about getting moving? So he's feeling better. So maybe a little bit more exercise. So Lori says gabapentin changed her dog's life, able to walk, sleep, and be happy. Yes. So many people are scared, or they say, oh, he's old, his liver's not. If everything's fine, let's try some drugs to make them feel better. And if they do have liver problems, we have other drugs that don't use the liver, so we could try some other things. Gina, you have a Beagle. They live for food. So, and they have the bark. They let you know, and he lives to eat. So I live to eat too. So let's see. I'll answer Danielle's, and then we'll wrap this up because I'm already at 40 minutes in, and luckily some of you have stayed with me this long. I'm feeling very conflicted. This is Danielle with my 15-year-old lab. She's completely aware, hungry, and happy, like a Beagle. That's what you've got. I help her with her back legs to walk, and she doesn't seem like she's in pain. I just started seeing some blood in urine. I think it's her kidneys now instead of a UTI. I made the appointment for 2 weeks from now. Oh, did you make the appointment to see us for end of life, Danielle, or her doctor? So that's just my question for you. I know how hard it is when they have a disease that doesn't necessarily take away their happiness. And this is where the difference between suffering, right? So I don't think you could be suffering if you're also happy, but it doesn't mean you're in so much pain that the decision is still correct. Right doesn't always mean easy, right? And what is right or wrong? It's tough. If your dog has to be let go, but they have mobility issues, let's say, and they're still eating and they're still happy and they're still wagging their tail, that doesn't mean they don't have a lot of pain and struggles. But what you can do is make sure that their last moment is a good one. So especially with lab, you need to go to Dairy Queen, Dunkin' Donuts, In-N-Out, wherever you may live, Wendy's, and make sure that they have a really good goodbye. Lori, can't wait for the cat book. I know, it's almost done. And I know, okay, so you made it with us. So we've got 2 weeks, and you need to make a bucket list and just go nuts and check them all off. I want you to take a picture of your bucket list. I want you to send it to me, Dr. Mary at Lap of Love. I want to see the pictures and everything, because I promise you that will make you feel a little bit better. It stinks that we get these angels and we have to give them back. I always say we just borrow them for a little bit, don't we? She's getting banana splits all week. I gotta tell you, Daniel, that's my bucket list too. Okay, so I think we're good. I think we're wrapping up. Sorry, I hate reading at the same time, but it's so nice to see so much conversation. Let me think, is there anything else I want to say? Also, I have this journal that if you search for me, by the way, the book is available on Amazon, Books A Million, Barnes & Noble, any of those. Oh, good, she's working on her bucket list. I also have this journal that has a good questionnaire, a health journal, medical treatment log, cognitive health assessment, because cognition's a big deal. tracking your symptoms. I've got joys of living and bucket list ideas in here. Caregiver quality of life, because it is important to make sure that you guys still have a quality life. So this is a great journal that is available. Also, if you search for my name, you'll find this one too. And also, if you have kids, saying goodbye, then we also have our kids book that I developed with Colleen Ellis that has a lot of fun activities for your kids to do even before the pet passes. Right now, these are the dog versions. Cats coming out soon. But I really hope that some of what I've said and also some of my other videos have been super helpful. So we're at 41 minutes. I'm supposed to stick under like 10 minutes, but I just can't stop because I love talking about the weak and the wobbly, the stinky and the stinky. Wait, that's stinky twice because they usually are double stinky. And next time I do this, please make sure that you post your questions. And until then, just kiss your old gray muzzles for me. Take care, everybody. Bye.